Thank you and welcome back again. So today we are going to talk about patient empowerment as a key for better health outcomes, especially when we're delivering care to the patient that we're serving. And the question for me is, how can pharmacies support this transformation? And as you all know that my main focus in terms of these particular videos has been looking at how do we repurpose and actually reposition pharmacies and help pharmacies deliver quality outcomes. And this is based on a bias because I'm a pharmacist by profession, and I believe we have a critical role to drive this conversation. So when I'm starting this from a reflection on this the particular recording that I did last week, and in that particular episode, the focus was on continuing medical education in terms of training and all that. And this was informed by a conversation that I had with a colleague within the healthcare space. And our discussion talked about trainings and capacity building programs because he works with a lot of focus programs on non-communicable diseases. And with that particular focus in non-communicable diseases, the major bit of it has been around empowering healthcare workers to be able to deliver healthcare interventions and support patients in their healthcare journey. But as we're talking about that, one thing that came out clear was the fact that as much as we're offering healthcare services to patients and serving the patient the best way we know how, the key is it helping them achieve that aspiration? And if it's not helping them achieve that aspiration, then we need to rethink our delivery model and rethink our solution in its entirety. Because for the end of the day, if we are delivering a solution and that solution does not serve the person it's supposed to serve, then what kind of a solution is it? Is it really doing what it's supposed to be doing? And that is where now we looked at healthcare services and patient empowerment as a key enabler towards ensuring we achieve the positive health outcomes that we all wish for. And those positive health outcomes should not be based on our metrics as healthcare providers, but they should be based on health metrics that are determined and actually established by the patients that are receiving the care. If you're going, for example, to keep someone in a life support machine for, let's say, for example, a year or so, is it for the best quality of life they would have wished for or not? And if you understand that, then you're able to serve them better. Somebody would tell you that I would rather have a short life that is meaningful and where I'm active rather than a long period of time of living. And that period of living is just that it's compounded to suffering. So would I rather suffer or have a well and fulfilling life for a short period of time? And those are the dynamics that we need to be looking at. And when we look at that dynamic of positive health outcomes for us, positive health outcomes for the patients, then we realize that there's a lot that needs to be done. And that which needs to be done is to enable patients to play an active role. So when I look at health service delivery as a component of itself, I look at it from a way that we can ensure we achieve positive health outcomes that are informed by the metrics determined and established by the patient. And this should be through provision of effective, affordable, and accessible healthcare services. And that links us to universal healthcare coverage and a focus on the primary healthcare component, because we understand that the main critical enabler towards achieving this universal healthcare coverage is working within the primary healthcare systems, where we look at the promotive and preventive aspects. Then we now advance into the curative, the more specialized services, palliative and rehabilitative. So can we ensure that quality healthcare services are available, and the ones that are available are effective, they're affordable, and they're accessible by healthcare provide patients that who need them, and the healthcare providers who are there and able to deliver this particular service to them the best way possible. And on that account, then if we talk about achieving positive health outcomes and defining positive health outcomes as those health services that give the patient the desired outcome, they give them the quality of life that they wish for, they desire, they aspire to attain, then that is a success for us. And therefore, for us to be able to determine that, the patient has to play an active role. And in playing an active role, we need to engage the patient to actually understand what are their main challenges in accessing healthcare services. Once we look at their challenges in accessing healthcare services, what kind of service challenges they might need to be addressed in that healthcare. Probably a patient has access to their medicines, they have access to a hospital that is closer to them, and the affordability is not an issue. Then the question you ask yourself, why is it that they're not improving in their care? For example, let's talk about diabetes. A patient should be able to monitor their sugar levels, and the sugar level should be within the recommended range, let's say 4 to 7 micromoles per liter. And in that particular level, then that range, if they're not achieving that, you need to ask yourself, why not? Probably they're not been trained well on the use of their insulin or their medication if they're using the oral anti-diabetic medicines. So how do you engage them to actually determine where is the problem in their care? And the only way to do that is through active engagement of patients in their healthcare service delivery and actually understanding what the dynamics or challenges they're having. One key example I just mentioned, you find some of the medicines have their own adverse events, side effects. And these side effects are already documented. They've been discussed and we know how they affect people. But if you give medications to a particular patient who will feel these side effects without them knowing that this was a probable side effect, they'll feel like the medicine is reacting against them. And if say they so feel, chances of them continuing that medication dies. So if they're not using the medicine, there's no way they'll achieve positive health outcomes. But the reason why they're having that challenge is because as a healthcare provider, as a pharmacist, if you're the person who dispenses the medicines, you did not enable them to actually understand that the medicine has some probable side effects, and how can they manage them? How can they live with them? How can they cope with them? Because if you don't address that, they don't be using them. And those are some of the key things that we're looking at. And currently, one of the key things we have to acknowledge is there's a transition and everybody talking about human-centered design. And these are working model where we're looking at designing solutions with the end users, not with the end users in mind. Because some of the dynamics that we're looking at in the project management space, we have interventions that have been designed by others for an in particular population. In pharmaceuticals, generally, let's say about medicines and delivery of healthcare services, a policymaker somewhere sits, an innovator somewhere, a business person, an implementer, healthcare provider, decides on the kind of care that a patient needs. The scientific bit, yes, but the outcome would be based on what the patient desires. So how do you make that happen? And to make that happen, then the key bit of it is working with them to know what works, what is the key challenge they're having. And then you look up some literature sources that we're currently seeing emerging in around patient-centered design, patient engagement and all. You look at it even from research. When we're talking about small molecules that are being developed, the new novel therapies, gene therapies, and related anti-cancer management, you've been dealing with patients, yes, you're giving them care for the cancer that they're having, but the treatment is worse than them having the disease. And I've had this conversation with some patients that were coming to the hospital at one point, and they're saying, well, I want to be better. I want my cancer to be cured if it is possible. And if not cured, then I want it to be managed the best way that I can have a better life, to have a longer period of life. But that quality of life is what I'm concerned about. When I come for my chemotherapy sessions, I'll go home and actually have a very terrible week, that entire week. It therefore means that patient in every month or every 21-day cycle of their chemotherapy treatment, they have to lose 7 days of active contribution and work, meaningful work in their lives. That is not quality. So how do we design human-centered solutions and interventions with them to be able to serve them better? It comes by understanding what was the challenge such kind of a patient is experiencing. Why don't they feel good after the chemotherapy session? Probably some of them were very tired. Some of them are actually having reactions to the medication. Some of them are having pain at the site of injection, dizziness. So what are these adverse events that they're experiencing? How can we manage them or even reduce them? And in managing them, it's not about giving them another set of medicine. It's a possibility, yes, but it can also be evidence that we can now inform the designers and the developers of the medicine that this medicine is actually good and it's doing this and this in helping manage cancer. But as much as it's doing this, it's affecting our patients in this particular way. Can you look at the particular molecule, the particular component or ingredient of this medicine that actually can be contributing to these negative side effects? Can we control it? Can we reduce it so that the patients are better? That will inform research and development, will optimize the quality of the therapeutic agent that is being taken into the market. And ultimately, it helps us ensure that we achieve positive health outcomes that meet the quality metrics that our patients wish for, that our patients need to be able to live meaningful lives. So those are areas that we need to look into human-centered design, bringing the patient, bringing the end recipient into the solution design. And the reason that's why I'm saying that we have a phase where people were doing things for our patients, and that was working. But at the end of the day, we realized that most of the outcomes were not favorable for the patient, but rather for the healthcare system and reporting mechanisms within the technical space and the policy space. And then there was a move that we need to do it for them, and it should be informed by them. Yes, it should be with them, but now we are working with them integral as key players. We've moved from for them, we've moved in consideration of them, but now we are working with them so that they give us the real-time evidence and experience of what they are going through. And that is where we are talking about human-centered design. It's a common journey. We are all on the same journey. And our mission is to improve outcomes for the patients. Therefore, the patients have to be part of the journey to let us know what are the intended outcomes, how do we help them, what are the challenges they're feeling, and how do we design a solution that is going to meet these needs across the journey. And when we look at it, some of the key things that we have to acknowledge is patient empowerment for meaningful patient engagement. How do we achieve it then? For me, when I look at it from the point of achieving it, then the key aspect would be one, we need to have health education and health literacy programs. There's no way that I'm going to contribute as a patient in a care program when I'm not informed about the care program itself, I'm not informed about particular diseases. And therefore, that is where when you talk about patient support groups, you see that some of them have expert patients. And expert patients know about the disease actually more than other healthcare providers that are in the space. So how do we take advantage of them? As healthcare providers, we have the technical know-how, the scientific background. Let's bring it to space. Well, that is the first win for us in terms of educating them. And once we've educated from a technical perspective as a specialist, then let the other patient community share their experiences. And that is a win with patient support groups. And that is why even when you talk about Alcoholics Anonymous, rehabilitation programs, we have patient support group where people share their stories, their experiences with a particular challenge. And if that wins, then there's a personal sentimental attachment to the condition rather than a technical specialist perspective. Well, as a healthcare provider, I am obligated to feel for the patient. I am empathetic enough and I feel their challenge. But I don't actually walk the journey with them to know how does it feel at night when you can't sleep and you're having the night sweats, for let's say, for example, for TB patients. How does it feel? If somebody who has experienced the same challenge and expresses that from a sentimental, emotional, human perspective, it relates with the other patients and they feel that they're not alone in that journey. Once they can bring the relatability component to the care delivery, then it's now upon us as healthcare providers, as pharmacists in our space, to leverage on that and actually design a solution that serves the patient where they need it, that meets their need where they want to go, and then supports them in that journey rather than giving them information and abandoning them. We need to walk the journey with them. So let us create awareness, one, they need to know. Once they've known, they come and be part of the journey. We have expert patients. Let them share their stories. These stories make them champions within the network. They're bringing the buy-in that we need, building trust, because we all acknowledge that trust has been broken in our healthcare systems, and we need to build in that trust. And it's not going to be built by us telling people what needs to be done, but by actually showing that we are willing to walk the journey with them and walking the journey with them across that care continuum. And that is where we have to start from. So once we know health education and health literacy comes into place, let's move to the next phase of patient engagement in their care delivery. We know in the initial component of the framework of healthcare system, we know the 6 pillars of WHO as espoused in health system strengthening. And other than that, we know that delivery of healthcare services in every country in the world is based on as a responsibility of the national governments or the governments, depending on how they're structured. So it's a responsibility of the government. And that means the government should ensure we have sufficient health workforce. The government should ensure we have health facilities. That is the curative aspect. And even integrate the primary healthcare component where we talk about preventing and promotive and ensuring the financing is optimal to be able to achieve that. And that means we need to drive advocacy, holding the leaders and our government officials responsible and accountable for the services. That is where we talk about health advocacy, being able to speak up for something, champion for it, and actually implement interventions that are helping us in that direction. The way for us is get patients to be our allies in making that happen. If we are able to do that, we are winning for the patients, we're winning for our healthcare systems, and the challenges that we're experiencing now will be a thing of the past if we do it the right way. So that is the key bit in terms of health advocacy. The health literacy and health education will come in as key at the initial moment, but once we've actually strengthened that component, we now take advantage of it to create a ripple effect in strengthening healthcare systems. That is for the general landscape and ensuring we have frameworks and structures in place to deliver quality healthcare services and then to ensure the positive healthcare outcomes are achievable. But beyond the healthcare system, what other mechanisms do we have? We need to get patients to actively participate in their care delivery. And this is something that I've been very passionate about. It's a conversation that I started in 2016, 2017, and it has been an ongoing journey. And that is where I'm looking at it from a medical advocacy, health advocacy component, and it needs to happen. When we go to our communities as healthcare providers, as pharmacists, let's say from that perspective, a patient comes to your facility and they come with a problem that needs to be solved, a healthcare challenge that needs to be solved. The treatment that you'll give them will determine whether they trust you or they don't, whether they use the services that you're giving them or they don't, and the level of questioning that they'll ask you. If they don't ask, probably they didn't understand. The best way to ensure you engage your patient is to make them a part of the journey, to give them the time to listen to the explanation. This started in 2016, as I've mentioned. At that particular moment, we have these conversations where you go visit a physician somewhere, a clinician somewhere, and before you even finish narrating, you have to give the case history, the taking the patient history and all that patient file. In the moment when you start indicating the problem that you're going through, the clinician or the physician has already assumed what would be the probable condition. So they start writing at the point of you starting to present your case. The name had already been taken when you are clerked, when you're getting into the hospital, when you booked the appointment. So a whole list of particular differential diagnosis has been made. The treatment plan has been established, but they've not even asked you questions. So once you finish narrating your story, you're being given prescription. Go buy these medicines, go take them, receive the medicine from the pharmacy, or go do these lab tests, depending on the facility where you are and the need as determined by the physician. But as a patient, I've not been engaged. And most of our healthcare problems, they might not be those physical conditions that we're suffering from. Some of them are psychosocial, are psychological. And therefore, we need to look at the human emotional component of our healthcare service. Do we engage with patients to make them say, we are here to walk the journey, we're here to feel for you, and we are human beings with social needs, need to connect. I need to feel like you really care about my challenge. You're able to walk the journey with me, to give me the care that I need, and then we can move that journey together. If we fail to engage patients, they'll not get the benefits, and that will be a loss for the entire healthcare system. So for us, the first thing is need to engage with the patient, let them express their challenge. Well, I'm coming to this hospital. This is the problem that I'm coming with. I have used this and this medication. They've not been working for me. And then how do we make it better? Probably you'll now ask a couple of questions. Once you've asked a couple of questions, got a better clarity, you're able to make a diagnosis based on the indicators that have been given. Then get to the next phase where the patient will now ask, why do you think this is the best medicine? Do they even know the diagnosis? And then when I talked about it, at that particular moment, my mother was in the hospital. She was diagnosed with ulcers. But then with ulcers, they did a couple of tests and everything. Then when she was sent home, ulcers is not it's a condition, yes, but in terms of the causative agent is what we need to be addressing. Lab works were done. Nobody gave her a clear indication on or diagnosis on what she was suffering from other than the ulcer. Actually, a panel of drugs were given. And of these drugs that were presented to her, when I looked at it from a pharmacy actually privileged position, I would feel like 2 of them would have managed because there were no clear findings. But there were all that list of drugs that were presented to her. She had to use them because she trusted the doctor. When I called from now being in Nairobi and she's in the village, she's telling me, I went to the hospital, they did a number of tests, they gave me this medicine, and I asked, what was the diagnosis? I don't know. They didn't tell me about it. So then what are they managing? I don't know, but I'll just use them. That is what they said. Did you get to a point of asking much? Not much. Reason? The doctor or the physician or the clinician at that particular level was distant from the patient. And we are working from a point of not giving the patient as much information as they need, but rather giving them what we feel is good for us. It's not about us. As a pharmacist, I'm not being treated. When I'm seeing a patient, I need to meet their need. Do they understand why they're what they are suffering from? Do they understand what medicines are being given to them? Do they understand how they're going to use these medicines? Do they understand the probable side effects? And in case they have a challenge, where do they report? How do they follow up on those? So that is where we look at the patient care delivery, and we need to engage patients. Let them help us design the treatment plan upon making a diagnosis as physicians. Then do we counsel them to make them understand the drugs that we've given? Do we understand their lifestyle so that we understand if at all there's anything that they do that would be affected by this? You're telling somebody, let's say, to take medicines 4 times in a day. This person actually is always on the move. Chances of them forgetting the medicine is very high. Why don't you give them a once daily medication or even once weekly, depending on it, the frequency of the medication? So we need to think of this and actually consider the patient parameters in our healthcare service delivery. Then adherence follow-up. Make them know why they need to use it in a particular way and why they need to follow up. The same example that I mentioned about a care of a patient who is having side effects and they don't know why, so they stop taking their medicine, they feel the drug is not good for them. But when they come to the hospital, you take measurement, let's say, for example, with diabetes, they've already stopped using their medicine, you're finding their levels at over 20 or something. You'll feel these patients are not responding. What will be your first move? Introduce more medication, up the dose. Yes, you're upping the dose. But is it because the medicine is not working? No. It's because the patient felt some side effects, they were not able to respond positively, and therefore they stopped using it altogether. If at all they were using it, their sugar would have been controlled. But you failed in your role to educate the patient, therefore their sugar levels were not optimal, and they are now suffering because you didn't do your job. So can we engage them? Can we do better? And I think we are able to do better. It's just that we need to make a conscious commitment to do better. And that is what I'm asking you. As fellow professionals and healthcare providers, let's do better and let's engage them in that. Then finally, I talked about self-care at one point in time. And when I talked about self-care, I understand that every individual, every human being wants an aspect of self-efficiency, self-determination, autonomy, to be able to run my life without depending on others every other time. And to be able to do that, that is why in the healthcare space, we are looking about self-care as a key imperative. And that means patients should be able to run their lives without having to be actually hospitalized in a particular institution, or without having to be zeroing down to a particular region because their physician is in that level. And how do we make that happen? We need to do that by looking at what is the need of that patient. How do we integrate them into a healthcare system? And now we have digital health solutions that are coming up. Taking advantage of digital health solutions, we can do all that away from them and with them. Can they monitor their sugar level? Let's say, for example, diabetes, that is what I'm referring to at this point. We have the glucometers, we have the glucose strips. Can we have targeted measuring and monitoring of their sugar levels? Then they're able to do that. Can they have a chart where they can actually be chatting with? And if not, some of the devices, smart devices that we're not talking about, some are coming up, and these that are coming up are able to actually take a track of these measurements. If they're able to take these measurements for us, that will be a win because the patient doesn't have to write them down. We are eliminating one possible error in terms of wrong transference or transference error that can come in terms of writing it on paper. So once we've eliminated that bit, we go to the next phase. Can we follow up with this patient? Can we have appointments that we are having, maybe phone call, Zoom meetings, video calls, and all that? We have that follow-up management criteria, counseling metrics. Can we have a digital repository where we can have interfacing where a patient I would be in Kenya today, tomorrow I'm in Rwanda, the other day I'm in South Africa. If that is the case, the dynamic of that movement, do we have a common IT infrastructure where if I'm in that location, well, I can talk to my physician in Nairobi or in Kenya, but other than that, there's an ability that in case of a crisis, I'm able to interface with another clinician or a physician, or even a pharmacist that is based in the country that I'm in. If we are able to do that, we are going to help patients. And our mission, as I've stated, is to ensure we achieve positive health outcomes for our patients. And that positive outcome is based on their own metrics as patients, as healthcare service recipients. And for us to do that, we need to design it with them. And designing it with them means we walk the journey with them and help them be the best versions of themselves by achieving the positive health outcomes, being a member of the team that is designing that solution, and winning with them, because we need to win with them. I don't want to have a case where my mom doesn't get the quality care that she needs. And if I'm able to help that, then that would be the best thing for me. And that transformation is already starting when we talk about pharma industries doing research with patients, getting patient in feedback in terms of pharmacovigilance interventions. When I talk about pharmacists' role in NGOs, I was talking about self-care. I'm talking about medicine, advanced events reporting mechanisms. Do we see these? And do we empower patients to be able to participate? And when I talk about adverse event reporting, I've just remembered the Pharmacy and Poisons Boards recently launched the electronic PV reporting mechanism systems. There's a short code, there's the PV system, the platform online application, and there's the website. Do patients know why they need to report? Do they know what they need to report? Do they know how to report? If they know all that, it's a win for us because that patient can help you improve your molecule as a pharmaceutical industry, can help you as a healthcare provider, pharmacist, a doctor, physician, to improve the care for that person. And ultimately, we are all winning for the patients. And therefore, we have an enabled and a strong healthcare system. I'm hoping we're able to discuss more about such and we're able to share insights as we grow the profession and serve our patients better. See you in the next episode. And in case you have any concerns and inquiries, reach out to us at African Pharma Network. I've shared the link in the particular description of this video and every other video. There's africapharmanetwork@gmail.com. Subscribe, like, and let's engage as we improve the practice of medicine and self-care, healthcare delivery. Thank you.